All right. Hello, everyone. Welcome to our Facebook Live today. We're going to talk about a very timely topic right now, which is allergy season with our springtime sniffles and sneezes. And I'm here today with Brittany, and she is one of our nurses and certified specialists in poison information. She is on the hotline today, actually. And so hopefully, if you ever need us, you can call, and she is one of our many call specialists who can take your call. So we're going to go ahead and jump right in with talking about allergies. Go ahead, Brittany.
Yes. Hi, everybody. My name's Brittany. I'm one of the nurses here at the Poison Center. And so what are seasonal allergies actually? So they are actually conditions that can cause sneezing, stuffy or runny noses, itchy eyes. Some people describe them as hay fever. Typically, these are caused by pollen from trees, grasses or weeds, mold spores, and actually there are 30 different types of pollen. The tree pollination, biggest culprit, as you can see, here recently, they just fall everywhere, all over our cars, ground, everywhere. And they can fall in the spring and early summer, and ragweed in the late summer to fall. Mold can grow quickly in the heat and high humidity, which is very common here in the Midwest. And when the day is windy and warm, the pollen counts surge. There are many ways that we can prevent our exposure to allergens. The best way is before we leave the house, we always want to make sure that we check the mold and pollen counts, the report every day. They can be found on the radio, newspaper, online, and the counts are highest midday. So try to go out if you're very sensitive to these allergens. Go out early morning or late afternoon. If the counts are high, we want to stay indoors. If you have to go outside, you can use antihistamines about 2 hours prior to leaving the home. We want to stay indoors on dry, windy days. And the best time to go outside is after the rain, which helps clear the pollen from the air. We want to keep windows and doors shut during the allergy season if you're very sensitive to these allergens, to prevent any exposure. And after being outdoors, you want to take a shower and wash your hair, change your clothes, just to rid your body of all of those allergens. And if possible, you want to make sure someone else can do the lawn mowing or yard work or gardening, especially on these high pollen count days. Now, there are different ways that we can treat our seasonal allergies, but it's very important to remember any treatment, even over the counter, should be discussed with your healthcare provider before taking them. We can use nose rinses. Sometimes that rids the nose of the pollen. So your neti pots or just saline spray. There are steroid nose sprays, and these are often recommended first for stuffy or congested nose. They can be both prescribed or over the counter. And antihistamines, which help with itching and sneezing and runny noses. But we have to be careful when we take these because it can cause drowsiness. So no operating heavy machinery. A lot of times we recommend these at night before bed as well. And there are antihistamine eye drops, which are used for dry, itchy eye symptoms. There are decongestants, which reduces the stuffy nose, but we do not recommend them for people with certain medical problems, such as high blood pressure, who may be on medicine for this. There are specific different types of decongestants for those patients, which you want to discuss those with your healthcare provider before using them. We want to be careful with decongestants, same as the nasal sprays and orally. They can cause a rebound congestion as well. Allergy shots can also be taken. They're called immunotherapy. They can be done weekly or monthly in a physician's office. The shots contain a very small amount of the allergens, which help your body build a response to it. May take a while to work, sometimes as long as 12 to 18 months, but they are very helpful. We want to be aware of all the medications that we're on. It's very important to know your medications, both prescription and over the counter. You should know the name and the dose of the medication, why the medicine is prescribed, and what it treats. The most common side effects, as we discussed, drowsiness, and what you should do if you miss a dose. You should also know any medication allergies that you may have. And it's very important to keep a list of all of these medications on for your healthcare records, whether it be a little card in your wallet or your purse, or even just a list on your phone. It's also very important. We get a lot of calls on accidental double doses, whether it be parents giving their children their antihistamine at night or during the day. The parents don't communicate with each other, or the caregivers don't communicate with each other, and the child ends up getting 2 doses within an hour or so time span. Or even an adult patient forgets that they take their antihistamine in the evening. They may fall asleep, late afternoon, think it's morning time, take their other medications. So you always want to make sure that you communicate with other people in the home that the medications were given, or if it's yourself, maybe even write a little note on, the table or on your phone, just a reminder that you did take your medication. And now here is Amanda for more medicine safety tips.
All right, thank you very much. I do want to mention that if you have any questions, feel free to put them in the chat box, and we are more than willing to answer some of those about allergies or allergy medicine. And so just some general medicine safety tips. They do have to do with allergies, but any medication, we want to make sure we read that label each and every time before we use the product. All too often, as Brittany said, we grab the wrong bottle or we misdose because we're not paying attention or reading properly. And we've already talked about keeping that medicine record handy, available, and up to date. And it's really important to store any medicine that you have for multiple people, say 2 children or spouses in different locations, because those can often be grabbed by the wrong person or even taken by mistake. And to that point, we also talk about making sure that when you take your medicine, the lights are bright, you're able to read the label clearly, even put those contacts in or those glasses on, especially if you're getting up in the night to take medicine. It's very important. And then some medicines are ones that we can't crush or break open because of how they are dissolved and how they work in our body. So we want to make sure that we check with our physician or pharmacist before we do any crushing or breaking of those tablets. And then we always say with medicine, it's really best to keep them all within the same pharmacy, to have them filled by the same place. And that really helps to prevent medicine errors. Your pharmacist should know you best. They should know all the medications you're on, even over the counter. And then they have the ability to check and cross-reference everything, as well as check your allergies if needed. And then when we talk about our kids and medicine safety, it's really important, as I'm sure you're well aware, is to keep those medicines, even over-the-counter medicines, eye drops, nose products, and oral medications, up high and out of reach of children. Children are very curious. Children do get a hold of medicines every day. And we know there's no such thing as child-proof packaging because children, even as young as 2 and 3 years old, can open a child-resistant or child-locking device type bottle. And so it's really important to have them locked up as well as put up high. And then just good modeling behavior. Now, if you're in front of young children, it's important not to take medicine in front of them because that's very confusing. They might think of it as candy, and that sets them up for possibly taking it in the future. And then each and every time we take medicine, even if it's something we take every 4 hours or every 6 hours, it's really important to put it away after each use. That's kind of a pain to do, but it is important to put it away, lock it back up each and every time. And then additionally, we have lots of visitors in our house from time to time, whether it be a grandparent, a family member, or babysitter. It's important to talk with them about any medicines they might have in a bag or a purse or a coat, and make sure those are put up away each and every time. We especially see lots of exposures with our medicine boxes, sort of those pill planners that people take their weekly pills with, and kids opening those pretty easily and getting quite a bit of medications. That's almost a daily occurrence, I would say, on the hotline, as a child getting into a medicine box or pill planner. All right, well, I am going to wrap it up. We always want to make sure that you have the Missouri Poison Center and the Poison Helpline ready to go when you need us. Here it is as well, 1-800-222-1222. And again, we're there. We're nurses and pharmacists who are specialists in poison information, as well as it's very fast to call the Poison Center. It's certainly free to call the Poison Center, and we definitely keep your information confidential. And we're available to you 24 hours a day, 7 days a week. So we encourage you to call with any questions or exposures. So thank you very much. We appreciate your attention, and I hope your allergy season is well. And if you have any concerns or questions, give us a call. Thanks.
Bye.